I want to move on to COVID, though. You're heavily involved in this COVID recovery group. Again, another group of backbench Tory MPs formed in opposition to some of these latest lockdown measures. I wonder, for the benefit of the audience, if you could give a quick assessment of how you think the government has handled this crisis. I suppose we can split it in half. One is the initial lockdown in March, and the other is, I suppose, everything from maybe the summer or the autumn onwards, and then we can have a chat about the ins and outs. But I think a quick assessment from yourself would be beneficial.
Yeah, I think it's a good division there. The original lockdown in March, I think lots of us were concerned that the government was taking very wide-ranging emergency powers, but were content to let it do so. And indeed, the House of Commons didn't vote, it just nodded through the Coronavirus Act late in March last year. But of course, we were being told this was in order to lock the country down for 3 weeks to prevent the possibility of intensive care capacity in the NHS being overwhelmed. And at a time when we didn't know just how dangerous COVID was going to be, was it like Ebola or the Black Death, or something significantly less bad than that? And I think the knowledge that we've got since is that it's something which is considerably worse than a bad flu year, but isn't Ebola. It lies somewhere in between, and we've gained a certain amount of knowledge about what is effective and what isn't effective in dealing with it. And in some ways, I'll just say the earliest key piece of information was that the first wave was falling before the first lockdown started, which suggested that some combination of hand hygiene and social distancing done on a voluntary basis was having an effect on the levels of infection. So, I think that was an important point to take on board. The fact that we then had the 3-week lockdown going on for 3 months before it started to be relieved was also significant.
There are people, and I know you will have heard this before as well, who look at, I suppose, Tory MPs, but people across the board saying things like this, things like a quote from you: arbitrary rules and limitations on freedom should be removed. Or you saying, for example, that, and this is not, this isn't a revelation, this is a well-known quote, that some British people were too willing to stay at home, and they will respond, classic Tory, only cares about the economy, wealth before health. Live and let die, everybody get out there, and if you're vulnerable, do your own thing. I suppose in a period of real national consternation, you can understand why people react in certain ways. My question, though, is there a real alternative to a lockdown, in that it seems though, transmission rates are the problem, and a very effective way of lowering transmission rates is to encourage people through coercion, in this case, through regulations and closing bars and pubs or whatever it is, to stay at home? I mean, it seems like a fairly logical equation.
Logical equation, if you could say that it certainly worked, and if you could say that it was clearly the case that the harm that it does isn't greater than any benefit that it brings. So to take various aspects of what you've said, first of all, I say I in many ways go beyond what the COVID recovery group would say, or at least the position that some of them say and have taken, and that I would say that some of those human rights are an absolute. So I would vote against these measures on the basis that we have legislated to make it illegal for people to see their children or their grandchildren. The fact that we now, for most of the last year, have been in the position of putting in place grossly inhumane restrictions on visits for people living in care homes, and people in particular with dementia who don't know why they appear to have been abandoned. So there are things in the restrictions that I would simply never support. Certainly not for more than a 2-3 week period. That kind of exceptional, this is something we must do in an emergency.
Can I interrupt you just there to say that, and I don't want to get into sort of ethics too much, on one hand you say it's an absolute human right,
Yes.
and on the other hand you say, well, I would actually stomach it for 2 to 3 weeks. I mean, is it not the case that if you're going to allow for these what you perceive to be absolute human rights to be suspended in some cases, then it's just a fairly legitimate debate over where that line should be. So you'd be well within your rights to say, well, 100,000 people have died in this country. We can suspend what you perceive to be absolute human rights.
No, I think that is the crucial question. And you're right. I shouldn't have said an absolute. Indeed, I said to Boris Johnson in the House of Commons, it's not an absolute, but it should be the strongest presumption. And so I think that is exactly the question we needed to ask ourselves. And we never really have. We've never had the proper debate. And I think the nation asked, will you put up with this for 3 weeks last March, was reasonably happy to put up with it and say, fine, I won't see the kids. We won't have that birthday party, whatever it was. It didn't seem like a huge sacrifice. You roll it forward for a year. You then have the Belfast variant, or whatever it might be, that's the latest new concern about the spread of COVID. And there's a reason for rolling it on for another 3 months. And then maybe it's just not safe to do these things at all. So, I just think it is a critically important issue. We've never really had that debate as a country. So that's the first thing. Second thing I wanted to say, you quote that point, people being too happy to stay at home, at a point in the late spring when we were looking at when to open up to an extent. And the reason I raised that was having just had a conversation, a number of conversations with a local business who said, we've still got 25% of our order book to fulfill, and I need some of my workforce to come in order to keep things ticking over. And I can't get anybody to come in. They're all saying, no, I've got a right to stay at home on furlough. And the concern was that if they did all stay at home on furlough, there wouldn't be any jobs at the end of that period when they wanted to go back to them. And the business in question duly went bust in September with a loss of 850 jobs. So I make no apologies for caring about other people's welfare and their livelihoods. And then the final point I wanted to make, because your division between March and the summer, it really is the point where I thought this needed to be looked at in a different way, because it was the end of July when my part of the country was told, most of Greater Manchester, we were told, the rates there were about 35, 37, I think, per 100,000 in my borough. They're so high, we're going to put you into strong additional restrictions. So for most of Greater Manchester, we've had a ban on household mixing, for instance, since then. We saw under those severe restrictions, we saw the rate of positive tests go up significantly. We've seen it fall, we've seen it go up again. There's no direct correlation with whether there is lockdown or restrictions or not. And similarly, on this third lockdown, you could say it's because of tier 4 restrictions. I don't know, you can argue that one way or another. You saw a big spike starting mid-December, and it started falling before the lockdown was put in place, and has been falling fairly strongly since.
There's a load in there I'll pick out a couple of there, and I don't want to get too ethical. You mentioned two things. One that struck me in particular, that question to do with jobs. It's clearly the case that if a workplace is fundamentally unsafe due to COVID.
I wasn't.
Okay, well, this is an interesting question. Is that what in your perspective? Sorry, I wasn't saying that workplace was. I'm saying that if a workplace is fundamentally unsafe due to COVID, I think most reasonable people, and I wonder if this extends to yourself, would say it's fair enough that a worker should be able to say, I'm not comfortable to go in there. Where do we draw that line between a worker having a right to say, where would you draw that line between a worker having a right to say, I'm not comfortable to go in there, that I don't believe that to be COVID secure, I'm worried because I have immunocompromised wife or girlfriend or husband or boyfriend or whatever it is, I won't go in, and the problem that you've identified, which is people saying that when actually it isn't the case? Where does that line fall? Because it's a difficult question.
I think most reasonable employers would seek to be accommodating for somebody who had personal circumstances which made them feel more vulnerable, and I think that's right. But I think by last summer, we'd had an enormous amount of effort going into the establishment of working arrangements and principles for working arrangements, which sought to ensure that you could have COVID secure workplaces. And so, I think the answer is, if the workplace is COVID secure and it is possible to work within that environment safely, then it's a reasonable expectation that people should. If there were additional personal circumstances, such as the ones you suggest, then I think an employer certainly ought to try to accommodate those.
And do you think that should be legislated for? That people with unique circumstances have a right to decline to go into work and can't be fired from their job for it, for example?
I would have to take legal advice. I don't know whether you would need to legislate for it, and that I think if there is a legitimate safety concern, then I think probably there is already protection in place.
I have a couple of questions that have been sent in on COVID that I want to get to, and then we just got a couple of random ones to finish up, because you've given us plenty of your time, and I very much appreciate it. And this is you're clearly ideologically opposed to many of the restrictions that are currently in place, and we've established that. What do you think somebody is within their rights to break the rules if they are ideologically opposed to them? At what point, you said human rights or near absolute human rights. If somebody considers something to be an infringement upon a human right or an absolute human right, at what point are they allowed to break a law and you would see them as being morally in the right?
Well, I mean, I generally would say the difference is, if you live in a democracy, you should obey the law. And I think it's particularly incumbent on people who are legislators. I can vote against things in Parliament, I can speak against them, and I can get as angry as I like about them. If I'm in the minority, you then go along with the democratic wishes that have been expressed. Having said that, I guess to look at a kind of topical case, seeing the sort of Amanda Holden outrage at the weekend, I think most people, if they got a sort of distressed call from an elderly parent they hadn't seen for a year, might well think, well, I'll go and make sure they're all right. And the boundaries in these guidelines would be difficult in those circumstances. If it was a health emergency, then it might be all right. If it's somebody who is having a sort of mental health crisis because they're feeling isolated, or they're worried about the circumstances they're in, then maybe it's all right. Certainly, I would not condemn somebody for an act of compassion.
But see, that's, I suppose, the problem, though. And we're not going to get a solid answer here in the end. I recognize that if those things are against the law, though, it's hard to build compassion into regulations, is it not? And would you defend somebody like Amanda Holden and say that she shouldn't be, the law shouldn't apply in that case because of some sort of compassionate circumstances?
I think it's quite a good idea for prosecutors to take a kind of enlightened view in balancing these things. And it's one thing to prosecute people who have deliberately subverted the law and organised a rave for 1,000 people. The person who drives 200 miles to check that their elderly mother is all right, it feels to me like that's in a different category.
Okay, I want to ask a question from Grant. I'd like to ask Sir Graham, is he at all concerned that the 2019 intake of Tory MPs are not holding the government to account as effectively as they should over the coronavirus restrictions? Somebody's not happy with the latest intake?
Well, what I say, the House of Commons hasn't done what it should have done. And it struck me the biggest point of concern for me was it was the 6th of January when we had that vote on the third lockdown, because it just seems to me that even if you were prepared to support the lockdown, it was wrong to vote through those powers for a 3-month period. And that was the exchange that I had with the Prime Minister in the chamber, was to ask him to allow us votes at the end of January and the end of February as well. And I just don't think Parliament, the House of Commons in particular, should simply cede that degree of authority to a government for that period of time. And that, I think is a very, very serious concern.
Do you think that this government has been deliberately, subversive in sneaking through some of this legislation that gives them all sorts of powers?
I think it's almost a law of nature that governments will seek to increase their powers and will seek to do things with less scrutiny if they can. And it is possibly the most important role of Parliament to be the countervailing force in that equation.
It's not a terribly bright indictment of government that they will try to get away with whatever power they can.
I think governments tend to do it, and it is why it's important to have the right checks and balances and try to make sure that you've got an independent Parliament that is prepared to stand and stop that from happening.
And that refers nicely to our conversation earlier about backbench government MPs. A final question on COVID from Keir. Excuse me. Could I ask Sir Graham whether he thinks that it is now likely that lockdowns will become a go-to measure whenever the NHS is under pressure from a future pandemic or a bad winter flu season? I think I recognise that question, but yes. Will lockdowns become the new normal?
Well, they mustn't. And I think, as is well known, the World Health Organization says lockdowns should be a last resort, and they should be a last resort because they do so much harm. They do obviously enormous economic damage, but they do enormous damage to people's health. 2 million people who have missed screening appointments over the last year, and I'm told there's simply no capacity to catch that up. At least 30,000 fewer people having treatment for cancer than should be in a normal period. People who've missed treatment for strokes and heart disease. The massive mental health crisis, threefold increase in eating disorders reported amongst young people. These are things that have massive long-term impacts. And to the detail of the question, in order to prevent the NHS from being overwhelmed, well, obviously at the beginning of this pandemic, the government put in place the Nightingale hospitals. We should have had the capacity necessary. In fact, of course, in practice, the NHS has coped. I think it's been difficult in a lot of places, but actually, I think one of the not often enough told stories is how well the NHS managed to use that surge capacity to make sure that at the most difficult times, it did manage to cope. But if we need to increase capacity at certain points of the NHS, and maybe it's the number of critical care beds, then we should do that. It would obviously be a more sensible thing to do than contemplating another lockdown.
It's difficult, though. I was having a conversation only the other day. This is a final question on COVID, I promise, with a student nurse working in the NHS who, I'll be honest, didn't have a lot of time for Tory MPs because of what she perceived to be 10 years or more of underfunding in the NHS, austerity in the NHS, which, according to her, had put the NHS in a position where it was further back than it needed to be. And you've just cited examples of deficiencies in care beds and ICU and all these kind of things. Was any of those decisions made with the NHS under the last number of Conservative governments ones which you regret?
Well, actually, I think the number of hospital beds being reduced and the number of critical care beds, I think that started under the Blair governments rather than Conservative government. And I think it's something we ought to look at carefully in the context of the experience we've had. I suppose that the difficult thing to say, but important to say, is that things have consequences, and that just as the regulatory mismanagement that led to or massively exacerbated the scale of the banking crisis had consequences for the public finances, which, whilst the NHS was protected, did mean that its funding wasn't going to increase at the same rate as it might otherwise have done. Since then, we have had the biggest ever increase in NHS funding over the more recent period of 3 years. But it's also important to say that the enormous cost of lockdowns, at the moment we're looking at, 280 billion of additional borrowing this year. That is money that, if it hadn't have been spent in paying for lockdowns, could conceivably have been spent doing other things.
But would it have been spent doing other things? Because that level of borrowing is obviously something that a Conservative government is not inclined to do.
Well, I don't think any government has been inclined to do it, because it's not a very sensible thing to do. And the reason it's not a sensible thing to do it is that it needs financing in the long term, and that reduces your ability to pay for the things you want to pay for on an ongoing basis, including the NHS. So, it's not an either or. You have lockdowns because you care about the NHS. Lockdowns have to be seen as the very last resort, not least because if you carry on having lockdowns, you won't have the resources to do the things you want to do in public services.